Maddie. I'm going to be your nurse today. Before I get started, I'm just going to go ahead and wash my hands. All right, I'm just gonna provide some privacy, and then I just wanna make sure that I'm in the right room. Can I just get your name and your date of birth? Checking your wristband. All right, looks like I'm in the right room. So today, with your permission, I'm just gonna be performing a wound assessment. I'm gonna be obtaining a culture, seeing how it looks. I'm going to also redress the wound, if that's all right with you. Perfect, all right. I'm gonna go ahead and raise your bed up to my waist height so I don't have to bend over. Using good body mechanics. And then on a scale from 0 to 10, with 0 being no pain and 10 being the worst, how would you rate your pain today? A 0, perfect, all right. I've already taken the patient's vital signs to establish a baseline. I'm gonna go ahead and put my PPE on now. For the purposes of this video, I'm gonna do it here, but if I was doing it in real life, I would put my PPE on outside before entering the room. Some gloves. I'm just gonna go ahead and pull the covers down if that's okay, all right? Just wanna expose that leg. All right. Let me know if you feel any pain throughout the procedure or need me to stop it all. Go ahead and remove the dressing. All right, I'm just looking at the color of any discharge or exudate that might be on the dressing. I'm noting any odor and just inspecting that. I'm also going to look at the gauze, looking for any color on there. And then I'm gonna go ahead and put this chuck underneath your leg just to make sure that if we have any discharge or runoff or anything, that it doesn't get all over the bed. All right, I'm just assessing the wound now. I'm looking at the color of it, noting any discharge or exudate and what color that might be, noting any odor if there is one, seeing if I can see any edema around the edges, looking for redness, irritation, any signs of infection. And I'm gonna go ahead and discard my gloves now and wash my hands once again. All right, and we're gonna go ahead and set up our sterile field. all right. So I'm just gonna take some gauze. Making sure it's not touching the sides of my little box. Right. And we're just gonna pour some over the top of my gauze. Perfect. I'm gonna go ahead and clean the wound now. And I'm making sure not to touch the skin while I do this. Just cleaning the outside. And I'm making sure to just clean the wound while I do this. And just down the middle, making sure not to touch the skin or the wound at all again. And I want to note that there's no excessive wetness, so I don't need to pat the wound dry. I'm gonna go ahead and obtain a culture from the wound now, so my CNA is gonna come in and help me.
Hi, my name is Macy. I'm just gonna be assisting Maddie. I'm gonna wash my hands and put on some gloves.
All right. I'm gonna go ahead and insert this into the deepest, cleanest part, just twisting for 4 to 5 seconds. Take it back to the lab. I do want to note that I would not be touching any of that. I would just insert it right in without touching any of that, and then she would send it off to the lab, so I'm still sterile. I'm going to go ahead and measure the wound now and check for depth. Try not to touch the skin. So the wound is about 5 or 6 centimeters by 9 centimeters. And my CNA is just gonna go ahead and bring me another swab.
Wash my hands again.
So I can check for depth.
And put on some gloves. I did run to the lab.
So we're just checking for depth of the wound here, inserting it as deep as it can go. And then I'm just gonna measure without touching. It's about 1 centimeter deep. All right, now my hands are still sterile because I did not touch the skin at all. So I'm gonna go ahead and just gently palpate the wound, just around the edges. You let me know if you feel any pain, okay? And I'm just feeling for any edema, any abnormalities or enlargement, irritation that I notice. And there is none. So now I'm gonna go ahead, I'm no longer sterile. I'm gonna change my gloves and wash my hands. ahead and just wash my hands again. All right, now we're gonna put on our second pair of sterile gloves. I'm making sure not to turn my back to my sterile field. So now I'm going to go ahead and I am going to pack the wound. Making sure not to touch the outside at all, just packing the inside. Wound. All right, we're gonna place some clean, dry gauze over the top. And then I'm just gonna put this pad over it. We're going to apply some tape just to secure this. And I am no longer considered sterile after this because I'm going to be touching the patient's skin, but everything underneath the bandage is sterile. Are you feeling okay? All right. It's all secured. I'm going to go ahead and have my CNA come back. She's going to help me by supporting the leg while I'm wrapping the wound. Wash my hands again. Perfect, and we are wrapping from bottom to top so we don't cut off the blood flow. You doing okay still? All right, so we're just wrapping the wound. Perfect. I'm going to go ahead and just secure it with some more tape. Perfect. And then we are going to label the dressing so we know what time we did the change, who did the change, and what day it was done on. Just gonna grab my pen. So I'll put my initials on it, the day, so today is the 9th, and it is about 5:16 p.m. Perfect. All right, how are you feeling? Good? All right, I'm gonna go ahead and take off my gloves, wash my hands, put on a new pair of gloves, and then I'm just gonna go ahead and clean everything up, okay? Just gonna go ahead and wash my hands again. And put on a new pair of clean gloves. All right, how are you doing? Still doing okay? Perfect. I'm just gonna go ahead and clean everything up. So go in the biohazard container. And then I'm just gonna throw all of this away. I'm gonna go ahead and cover you back up. And I'm gonna lower your bed to the lowest position if that's okay. Perfect. And how's your pain doing now? Is it better or worse? Still 0, perfect. All right. I'm gonna go ahead and remove my gloves and perform hand hygiene again. All right, here's your call light. Do you need anything else from me or are you okay for now? You're good? All right, I'll be back in a few hours. Just let me know if you need anything, okay? And now I'm gonna go ahead and remove my PPE now. Perfect, and I've already made sure everything is good with her, so we are done and I'm going to leave.